Thank you all for joining us this Tuesday morning. I know that our legislators are quite busy, and we are grateful for the time that they do have to have this conversation today. I think everyone is just about ready to hear. Everyone's getting connected to audio. All right. So we'll go ahead and get started. I'm Shannon Moody with Kentucky Youth Advocates. I oversee our policy and strategic initiatives work here at KYA. And happy Valentine's Day. We're glad that we are able to connect and get together on this day. And we're talking about health services, and we know that we know how important it is for connection with others when it comes to overall well-being. And we're grateful to have the chair of the Health Services Committee from the House, Representative Mosier, joining us today. We do anticipate Senator Meredith joining us as he is the chair for the Senate Health Services Committee, but we know that right now he is currently in another committee meeting. So I think we're hopeful that he can join, but if not, that's all right. We've got an expert here with Representative Mosier and are grateful for your engagement today. One of the things that I did want to say that we know about both Representative Mosier and Senator Meredith is they take seriously the feedback and input of folks who are engaged in this process. We've gotten the opportunity to see them hear from constituents, from youth, from birth parents, from other folks as they lead these committees, and it has been really clear that commitment to at least hear from other people. And when we appreciate that approach as they make really hard decisions and make really important decisions for our kids and families across Kentucky. So with that, I am going to send it over to my colleague, Alicia Watley, who's going to be facilitating a conversation with Representative Mosier and hopefully Senator Meredith, and we'll take it from here.
Great, thanks, Shannon. So like Shannon said, my name is Alicia Watley. I'm a policy director here at Kentucky Youth Advocates. And so thank you to Representative Mosier for joining us today. And I actually think that Senator Meredith is joining as we speak. I think I see him hopping on, so that's great news. Perfect timing to jump right in. So the first thing that we wanted to touch on is really just the changes in committee structure that are coming with this session, and the decision to split from health and welfare and health and family services in either chamber in previous sessions to being two different committees this year. So we have one focused on health services and one focused on families and children. So Representative Mosier, maybe you could speak to just an overview of what you see the goals of the Health Services Committee being in the House as the chairperson for that committee. And then kind of as a follow-up, if you want to share what brought you into the health services world and that area of work as well.
Okay, well, thank you. Thanks for having me this morning, and I'm glad to see my partner jumping on. But as far as I don't know where you want me to start. I can start with what brought me here. My background is nursing. I was a neonatal intensive care and flight nurse for many years, and served families and really the pediatric population. So I've always been very involved and care about the health of kids. I later, after raising my own 5 sons, I got into drug policy and really tried to work with advocates on what was in 2014, 2015, the heroin issue and the impact that it was having on our communities. And so I did quite a lot of local policy. At the same time, I was working on medical legislative education or doing medical legislative education for folks who were involved with the local medical societies, the statewide medical society, and advocating for better health care as we saw a bit more government intrusion into healthcare with mandatory electronic health records, many mandates that really changed the practice of medicine and had some effects on patient care. And so that was what drove me to work in that space. So I worked with the KMA Alliance. I served as the state president, and then I also served as the American Medical Association Alliance president on a national level. And so I have kind of a smattering of experience on all three levels, state, local, and national. And then I was elected to the House in 2016. And so I have come straight in working on Medicaid issues. I chaired the Medicaid Oversight Committee right away. And it was interesting to me because that really was not my area of expertise. But, you know, in this role, you learn a lot quickly. And you learn a lot quickly because you work with advocates and people who actually work in the field. And so thanks to folks like you and many others, it was a bit of baptism by fire in learning about Medicaid, Medicare, all of the differences, all of the funding streams, and all of the things that the state has to work with to provide services. Now, on to the Health Services Committee. I have chaired the Health and Family Services Committee since 2019. And this year we decided to split those topics into two different committees to just allocate enough time for one committee to work on what I just really discussed: Medicaid issues, health systems, and that's the actual practice of medicine and healthcare with all of our different healthcare worker categories. So we are working on things like the healthcare worker shortage, funding, and so far today I've had a meeting on healthcare workers, BHSO rates, community mental health centers. Just met with Mary Hurst, and long-term care. So that's a quick snapshot as to what my mornings look like. We are working on lots and lots of topics, but mostly healthcare systems. Now, the Family Services Committee will, or is it Child and Family? I don't know what it's called. Will dedicate its time to issues around DCBS, foster care, child services. And so, we just felt that it was important to make sure that we have enough time to really dedicate time to these important issues.
Absolutely. Well, thank you for sharing about that, and welcome to Senator Meredith. I know that you, I think, joined right as we were beginning, so thank you for being here and for your time this morning. So I just want to kind of repeat that question to you as well. So hearing maybe what brought you into the world of health services as the chair of the Senate committee, and then also with the change in committee structure this year, what do you see the focus being? Probably similar to what Representative Mosier shared, but want to give you a chance to talk about your side as well and what you might be focused on.
Thank you. Appreciate the opportunity to speak with you this morning. Sorry, I ran a little bit late, but we just had our first Family Services Committee meeting, which I'm a member of, and I think most people know that my background is healthcare. I was a hospital CEO for 30 years. Before that, I was a chief financial officer for a hospital. Before that, I was in the long-term care industry, and I've never claimed to be a healthcare professional. I'm a businessman who had the good fortune and blessings to work in healthcare, and I've worked with some great people over the years. It's been such a blessing. And when I came to the Senate in 2016, the year that Representative Mosier came on board, I really didn't plan to be a healthcare advocate, and I don't know that I still am. What I am is a rural community advocate, and many should know that rural Kentucky is struggling greatly. And particularly if you look at our last census, our population loss in the eastern end of the state and western part of the state is really, I think, compromising our state. And I'd like to share the story that my first week here, I know Representative Mosier and I both were interviewed by Renee Shaw on KET, and she said, "I see you have 4 years healthcare experience. I guess you have a healthcare agenda." I said, "No, I really don't. That was a different life for me, a different time. I have too many other interests." And she said, "Well, such as." I said, well, three things come to mind: education, 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 because that's what we really have to invest in to move Kentucky forward. But if you look at my record during the Senate, you'll see that I'm a staunch advocate for rural health care. And I say that because that's the foundation of the economy for many of our rural communities: education and hospitals and nursing homes. Without those, there's not a foundation to build successful rural communities on. And that's kind of my mission. I'm not sure if rural communities been treated fairly or equitably over the years, and we've got to change that dynamics. So focus on the healthcare and improve the health population is one of the ways of doing that. Um, Representative Mosier may mention about the separation of two committees, and I think that's a great move because we just had so many issues we had to address. And I was chair of Medicaid oversight for years as well, and we would hear issues within that committee. Changes that need to be made, but as a statutory committee, we can't make those changes. It has to come to health and welfare, and are just so full that we never could, I think, adequately address the issues facing children and families. I applaud this change. I think it's going to be great. You know, one of the most tragic statistics for our state is the number of children that are living in poverty, and the number of children that have been abused, and we have to address that. And I just came from the committee meeting where I presented Bill 42, which will realign many of the responsibilities of County Health and Family Services. And one of the questions was asked to me during our discussion this past summer on our task force for the reorganization of health and welfare, did we look at making children's services a separate cabinet? And I'm not sure that shouldn't be explored further in the future because it's so important to the state of Kentucky. But there's a lot of issues that we have to address. I think as chair of the Health Services Committee, I'm probably going to focus more on processes and systems to make the Medicaid program more efficient, more effective. I've been a long advocate that we have too many people involved in healthcare from the administrative standpoint. You folks probably well know that we spend 16 cents every dollar in the United States on just administration of healthcare. That's double what other industrialized nations spend. And we could put that money to do so many other things. You know, a good example of that is our bill last year to have a single source PBM for our Medicaid program. And the savings on that has been phenomenal. I heard this morning that it's close to $50 million. And I was hoping we could use those services to expand services to some of the vulnerable populations, such as people on the waiver list for services. Also increase reimbursement to providers because it's woefully inadequate, particularly in rural communities. So that's probably going to be our focus during this session. We're going to say limited number of bills. Looking forward to the interim session, though, so we can hear more of the issues and really formulate a strategy and a plan for Kentucky that's going to truly improve the health of the population. And fundamental to that is having access to care. You know, having Medicaid coverage or having insurance coverage is really meaningless if you can't access a healthcare provider to get those services. I think that's the biggest struggle that we have. I have another bill I'm presenting this time that asks the Department of Medicaid to develop a payment methodology based on the deprivation index that the federal government does, which means that we reallocate resources of the Medicaid program to the most vulnerable communities in Kentucky. And by doing that, we create a win-win relationship for everyone that lives with that population and reduces poverty and helps everyone in the long term.
Great. Thank you for sharing about that. And you kind of started to get into one of my next questions, which is really, both of you have so much experience in this space and you've been here for several years working on these issues. So wondering about areas that we can anticipate could be built upon from previous sessions. One question that we had was last year we saw a lot of interest in some wins around maternal health during 2022. So if there are opportunities that you see to build on that work moving forward through your committees and what that might be, or additional areas that you think are going to be built on from previous sessions as well. Representative Mosier, I'm not sure if you want to speak to that.
Mm-hmm. Sure, I'm happy to. We did put a few or passed a few proposals that we had talked about for years. One of those was expanding Medicaid for postpartum women for 12 months. And we fully recognize that our maternal health and maternal mortality numbers are one of the highest in the nation. And there's just no good reason for that. We really have systems that I think we have in place, but how do we best utilize them? So we do have a few bills this session that talk a little bit about midwives and doulas and things like that. I don't know that we haven't had I don't think we've had a robust enough conversation around these issues to really have a concerted effort at this point. I'm just hearing, kind of a smattering of issues. We talk about postpartum depression. I think there's a bill to improve information and disbursement of preventative initiatives for women immediately following the birth of their child. So those are some of the things that I'm hearing about. We still are part of the child fatality and near fatality advisory council, and so I mean that helps inform us on some of the issues around the dangerous situations that kids, babies especially, are put in. But again, I haven't seen a truly concerted effort around this, and I think that's something that we could really use.
Great. Senator Meredith, anything to add to that one?
Certainly, and Representative Moser and I are both on the same page on this particular subject. It's been long overdue. It's been ignored. As a matter of fact, our first committee meeting this session, the first agenda item was maternal mental health and how we need to address that. And it was just a hearing. We didn't have a bill at that time. We had one that's, I think, going to be filed this week to kind of start the process. But it's a deeper discussion that we need to have. But probably the most impactful statement I heard during that testimony was that 90% of maternal suicides are preventable. I think about 90%. And one of the things that we don't do a very good job in this state is identifying the cost of doing nothing. And it's staggering when you think about it. And we need to be more progressive with those sort of issues and force hand on it to show that if we take action A, it'll result in savings for B. And we can't ignore that and continue to go down this dark tunnel that we have. So personally, I'd like to see that be a priority for us this session. I think we have a bill that will kind of kick it off, that all the parties haven't come to terms yet. But if not, what I committed to was during the interim, I would hope to have additional conversation about this, maybe have a more robust piece of legislation come in 2024. But I would hope just to send a signal to people that we're interested in addressing this, that we can have some kind of bill this time to kind of kick it off and build upon that.
Great. Yeah, thank you for that. And so with only a few minutes left, I do want to kind of shift gears and talk about another issue that I think is on the top of minds for many Kentucky parents and students, and that is teen vaping. So we know that 1 in 4 12th graders are vaping, 1 in 5 10th graders report vaping, and it's just a growing issue among many age groups across the Commonwealth, and even younger and younger children are getting engaged in this. So wondering if there's opportunities in each of your committees to address the youth vaping concerns and hopefully reduce the initiation of use with those products.
Yeah, I can go first. I've worked a lot on tobacco related issues and worked on the bill to eliminate tobacco use in schools a few years ago. We touched on vaping. Certainly vaping is part of that, but it was really related to tobacco use. We're all, of course, now seeing vapes contain illicit drugs and other products. So, I think as part of what we can do right now, and again, this is a bigger issue, but largely I think it's educational. We've increased the taxes on vape products. We've done some of those things that maybe are historically legislative. But I think just an awareness campaign around fentanyl, for one. I mean, we are beginning to see fentanyl pop up in vapes as well, vape devices. So I've got a bill that will deal with fentanyl test strips, but it also includes an awareness and education campaign around fentanyl. It's not specific to vaping, but I think as we get information out, we can certainly include that. Yeah, it's a tough issue. It's something that the tobacco industry is very good at, kind of sharing as or pushing on our young kids as a safe alternative, and we know that it is not. So right now, I think it's educational. Happy to work with you all if you have ideas about how to best deal with this on a state level.
Yeah, absolutely. And it is an issue that is pervasive in a lot of different ways, and especially in our schools and within education, we're hearing it a lot. So Senator Meredith, would love to hear from you as well if you have ideas on how your committee might start to look at this issue.
Yes, thank you. It certainly needs to be addressed. And there aren't even many issues that make me mad, but this one does. Because we have people that are profiteering on the health of our young people. And to me, that's inexcusable. And we fought the tobacco battle for so many years. I thought we had turned the corner on this one, and it's just morphed into the vaping situation. And it's inexcusable for the corporate America to promote this product the way they do. And so I hope we can be as stern as this we possibly can. Whatever penalties we can assign to it, I certainly would support. But yes, education's got to be a very important part of that, not only for our young people, but for their parents. That's one thing I do not understand at all, is how parents who have knowledge of this are accepting of it, because it's so tragic for our young people. And there's going to pay a significant price down the road that they're going to really regret, but it's an issue that we have to address. But I want to make sure we get our young people engaged in this as well. And I said committee meetings this summer that, I hate to fix other people's problems. And I think young people have to own this one. They should own this one. And I think it's part of growing up and accepting responsibility is they need to tell us in many regards, what do we need to do to fix this? And what can you do to stem the tide of this? Because it's that serious. And it's such a distraction right now from all the other things we need to do with our education systems. I've heard about making investments for vape detectors in restrooms and more security cameras. We need to be spending these things on textbooks and computers, and I resent it so much. So we have to have a more responsible society than what we've had in the past, and engage our young people in that process, I think, is an important part of that. But again, not forgetting their parents, they've got to take ownership for this as well.
Yeah, absolutely. Well, thank you both so much. I know we just had a short time with you this morning, but we really appreciate you all taking the time to join us and talk through these issues. And we're really looking forward to hearing more from the Health Services Committee, both in the House and in the Senate, and seeing both of your work that you will do to improve the health of all of our Kentuckians throughout the 2023 General Assembly. So thank you all for being here this morning. We appreciate your time.
Thank you. Appreciate the opportunity.
All right.
Thank you.
Thank you.